The Toxic Lady, Inside the Medical Mystery of Jane Doe. On February 19, 1994, paramedics rushed 31-year-old Jane Doe into the emergency department of General Hospital. She suffered from rapidly deteriorating late-stage cervical cancer, and her body was showing signs of systemic organ failure. Low blood pressure, rapid heartbeat, and labored breathing. But what happened in the next 2 hours would challenge medical understanding, spark debates among toxicologists, and eventually become one of the most perplexing clinical events in American history. Jane Doe will become known worldwide as the Toxic Lady. But behind that sensational label lies a story of chemistry, physiology, and unanswered scientific questions. When Jane entered trauma room 1, her vital signs indicated near-complete hemodynamic collapse. Blood pressure, dangerously low. Respiratory rate, elevated and shallow. Mental status, altered, consistent with uremic encephalopathy, meaning too much unfiltered urea causing brain damage. Skin, waxy and mottled, a sign of poor perfusion. Breath, a noticeable, unusual odor described as fruity or garlic-like. Her cancer was advanced and aggressive. Cervical cancer in late stages can lead to uremia, basically when the liver is unable to filter urea from blood. Hyperkalemia, too much potassium, and metabolic acidosis, all of which can trigger chaotic heart rhythms. Doctors attempted standard interventions. High-flow 100% oxygen through a mask. Diazepam, lidocaine, and atropine to manage arrhythmia. Saline, salt water, for perfusion. Preparation for defibrillation. External heart electrical shocking. But as staff worked on her, something profoundly strange occurred. The symptoms spread to staff. When a nurse drew blood, she noticed crystalline particulates in the syringe, described as floating, shiny flecks. Blood samples are not supposed to sparkle. This observation alone triggered concern for chemical contamination. Shortly after, a chemical-like odor emanated from the blood tube, and then the staff began to fall. One nurse slumped against the wall, struggling to stay conscious. A respiratory therapist collapsed. A doctor developed burning sensations and shortness of breath. A medical student began seizing and convulsing minutes later. Within 17 minutes, 22 hospital workers reported symptoms. 5 required overnight hospitalization. 1 was admitted for 2 weeks with severe organ involvement. These were trained professionals, resistant to panic, familiar with trauma and emergencies. The symptoms were objectively recorded. Something in that ER had caused harm. Now, the news of the incident spread to the regulatory agencies. The state investigation and its shortcomings. The California Department of Health Services launched a full inquiry. They evaluated airflow and ventilation, cleaning agents, hospital chemicals, blood samples from patients and staff, building materials, possible infection sources. No toxins, fumes, or leaks were found. The official conclusion? Mass psychogenic illness. In other words, mass hysteria. But scientifically, that explanation had major flaws. How? Organic damage, such as avascular necrosis of head of femur and hepatitis, cannot result from hysteria. Symptoms followed a dose-response pattern. Those closest to Jane Doe were affected the most. Onset was immediate after exposure, consistent with real chemical toxicity. Multiple staff described identical odors and visual phenomena. This left a scientific vacuum, and now led to independent researchers stepping in. An autopsy was ordered to get to the bottom of it. The DMSO hypothesis, a chemical chain reaction. The most widely accepted scientific theory today comes from the Lawrence Livermore National Laboratory, which examined an unusual compound discovered in Jane's autopsy. Some compound by the name of DMSO. 1. What is DMSO? Dimethyl sulfoxide is a solvent sometimes used by chronic pain sufferers as a topical ointment. It is believed that alleviates muscular and joint pain. This was banned from the market by Food and Drug Administration years ago. Although not FDA approved for general pain relief, it is known for penetrating skin rapidly, producing a garlic-like odor, causing the skin to appear oily or glossy, having crystallized forms under certain temperatures. This aligned with both the smell and the particles in her blood. 2. Metabolic and medical interaction. Inside the body, DMSO can convert into DMSO2, or dimethylsulfone, a harmless crystalline substance. This could explain the particles seen in Jane's blood sample. However, under conditions created in the ER, an unexpected chemical pathway may have occurred. Researchers proposed a 3-step oxidation chain, DMSO to DMSO2, triggered by oxygen therapy, DMSO2 to dimethyl sulfate, DMSO4, triggered by high oxygen concentration, cold environment, and electrical energy from defibrillation paddles, dimethyl sulfate formation, a known pulmonary and systemic poison. Thirdly, what is dimethyl sulfate? Dimethyl sulfate is an extremely toxic compound used industrially as a methylating agent. Exposure causes eye and lung irritation, muscle spasms, seizures, collapse, liver and kidney injury, bone marrow suppression, long-term necrosis. Symptoms appear within seconds to minutes, exactly like what the staff experienced. Every clinical presentation among the medical team aligned with dimethyl sulfate exposure. Now, could this reaction really happen inside a human body? This is where the controversy deepens. Arguments supporting the theory. Jane's body chemistry was unusual due to renal failure, allowing compounds to accumulate and pile up that would normally be filtered. She had likely used DMSO as a pain remedy, although of unknown amount, but supposedly a lot. Oxygen therapy provided an unusually concentrated oxidative environment. Defibrillation and electrical shock applied to bring her heart into normal rhythm provided electrical energy that could theoretically catalyze oxidation steps. Her cold body temperature slowed metabolism, allowing more stable conditions for conversion. Arguments against. No lab has ever replicated this exact reaction under controlled clinical conditions. DMSO conversion into dimethyl sulfate inside the human body is considered chemically improbable. Multiple environmental factors must align perfectly. To this day, scientists remain divided. Some toxicologists call the DMSO theory the most plausible yet imperfect explanation. Others believe an unknown contaminant or rare metabolic byproduct may have been responsible. The medical mystery endures. Just think, medical mystery can happen and we get to hear all the time. The media and the loss of identity. After the story reached the press, Jane Doe was transformed from a woman fighting cancer into a sensational headline. News anchors refer to her as a walking chemical weapon. Talk shows sensationalized her symptoms. Newspapers labeled her the toxic lady. But this portrayal stripped her of humanity. Jane was a mother, a partner, a young woman facing a painful, terminal illness. Her family described her as sweet, warm, compassionate, and caring, deeply caring for her children, and a person of faith and resilience. Well, what science still doesn't know. More than 3 decades later, the case remains unresolved because it raises difficult scientific questions. Can human metabolism under extreme illness produce unusual chemical byproducts? What do you think? Do medical procedures create conditions for rare reactions we've never documented? Are there metabolic pathways we still haven't mapped? Could an environmental factor have been missed because it was transient? Cases like this remind us of a humbling truth. Medicine does not know everything, and sometimes patients exhibit physiology so unusual that even experts struggle to categorize it. Final thoughts. A mystery at the intersection of medicine and chemistry. The story of Jane Doe sits at the crossroads of clinical medicine, toxicology, forensic chemistry, and human tragedy. Was she exposed to an unknown chemical? Did her body generate compounds never before documented? Or was the ER staff affected by a complex chain of environmental, psychological, and physiological triggers? Science may never fully answer these questions, but the case forces us to consider the fragile balance between the human body and the medical systems that seek to understand it. Jane Doe's story is not just about a toxic mystery. It is about a woman whose final hours challenge the limits of medical knowledge, and whose legacy continues to inspire scientific curiosity decades later. We would always appreciate your input, differential diagnoses, and power of your imagination. One of the take-home lessons is the fact that skin still is an important means of medicating and dosing patients. Patients must be educated of this important matter and warned of drug overdose by the means of dermal application of drugs. In one instance, a patient applied all of her lidocaine patches at once and ended up in CCU in critical cardiac arrhythmia condition. Ms. GL identity was replaced by Jane Doe, so we can only emphasize on medical aspect of this case, and not so much recall a misfortune, a loving person who became a victim of a complex biochemical accidents. Thank you for watching.